Yep. السلام عليكم ورحمة الله، مساء الخير عليكم. آه ننتظر الناس لحد ما تجي للسيشن، وبعدها نبدأ إن شاء الله. And- هو الموجودين سامعين الصوت؟ ممكن واحد بس يكتب في الكومنتس إنه سامع، وهل الصوت واضح ولا لا؟ وعليكم السلام. إجلال أسامة. شكرا فاطمة. الصوت واضح تمام ممتاز. بس حننتظر شوية كده، دقيقتين ثلاثة، وبعدها ممكن نبدأ يعني إن شاء الله. تمام. شكرا محمد نور، وشكرا وهاب. تمام. العدد ماشي كويس هسي، ننتظر بس حبة كده وتاني ممكن نبدأ، بس عشان الناس كلها تكون بدأت من البداية معانا إن شاء الله. تمام، بسم الله. طيب نبدأ. السلام عليكم مرة ثانية. أنا عبد الرحمن بكري عجيب بابكر، أو عبد الرحمن بابكر. واحد من السينيور كلينيكال فيلو، شغال في مانشستر رويال انفيرمري. خلصت حاليا الاي ام تي 3 just this August, and we will go today just to have some bits about the e-portfolio in general, and this is mainly for the people who are quite new to the system, either in training or actually they are new to UK as new NHS doctors. If you have any question at any time, just let me know with a comment, and then just let us know. حيكون recorded إن شاء الله. التوبكس اللي حنعملها ديسكشن الليلة، حناخد حبة introduction سريعة كده. حنشوف كيف الزول يعمل setting up للإي بورتفوليو، كيف الزول يمشي في البوست والسوبرفايزر سيلكشن. حنمشي في الكريكولم بتاع الاي ام تي mainly، وده بيشبه اغلب الكريكولم بتاعت الاذر تريننج. حنمشي through البيرسونال لايبراري واللوجون او اللوج بوك. هنعرف انه كيف الزول ممكن how to send the ticket to other people to have the assessment. هنتكلم شوية عن الريفليكشن، وآخر حاجة هنشوف حاجة اسمها the summary of progress. عشان تصل لل NHS e-portfolio أو ال e-portfolio اسمه NHS e-portfolio، هتعمل جوجلينج عادي، هتكتب NHS e-portfolio، هيجيك الويب سايت على طول. لو أنت في training they will already provide you with a username and password. If you are not in training, then you need to have an access, then you need to pay for it. And then you will receive your access for that. الصفحة الرئيسية بتاعت الاي بورتفوليو بتكون بالشكل ده. عموما لو انت at the training at the moment حيظهر لك البوست الحالي الشغال فيه هنا. انا عشان out of training now، خلصت ال internal medicine training، فما ظاهر لي بوست حاليا هنا، لكن بيتكتب لك الاسم بتاع البوست و how long you have زي الصورة دي. فبتكتب لك الجريد بتاعك انك انت IMT 2 ولا 3 ولا 1 مثلا. البوست بيبدأ 200 بينتهي 200. which hospital that you are doing the training at the moment, which specialty, for example, cardiology or gastroenterology or whatever, and how long this post will be, like 4 months or something like that. بقية الصفحة حنمشي في جزء من التابس هنا عشان نعرف الحاجات المين في الاي بورتفوليو. الهوم عموما بيوريك كل الابديتس الحاصله الجديده، زي ما شفنا في الصفحه اللي فاتت. لو حصل اي نيو رولز نزلت بالجي ار سي بي تي بي، او اي نيو رولز في التريننج او اكزامز ابديت، حيخطوها لك هنا وحتقدر تقرا الابديت على طول. حيدوك لينك مثلا او كده. الاكتيفيتيز عباره عن الحاجات اللي حصلت recently، لو في ticket signed او assessment اتعمل by the ARCB team، هنمشي في خلال through it، او يزول ملي لك فورم معينه فهتصل لك في الاكتيفيتيز. اول حاجه عندنا فاذا عملنا بريس للهوم هديك نفس الصفحه الاولى دي. التاب اللي بعدها بروفايل، واول حاجه فيها البيرسونال ديتيلز. بيرسونال ديتيلز لما تفتحها بتجيك الاسم بتاعك مكتوب. لو عندك الجيم سي نمبر حيتكتب طوالي. لو انت في تريننج بيتكتب لك التريننج نمبر. بيكون ظاهر طوالي، وعادة الإيميل طوالي، وعادة بيكون البرايمري إيميل، يعني it's not like an official email that it's written in here. بعدها it's better to put a photo of you just to let the people who are doing the assessment for you to be familiarized with your picture, and it will make it easy for them. وبعد اللوجين ديتيلز والكوميونيكيشن بريفيرنس دي حاجات خاصه لو اي زول داير يغير الباسورد بتاعته او اي شيء. لو مشينا لنمبر 2 اللي هي بوست اند سوبرفايزر ديتيلز، لو انت اثناء التريننج فحيظهر لك البوست اللي شغال فيها. فمثلا لو قلنا ده الاكزامبل، ف الزول ده محطوط في year 2، الجريد بتاعته IMT2 in program, location بتاعه this hospital, doing cardiology from this day to this day, and those are the names of the supervisor that they are doing the assessment during this period. Supervisor عادة بيكونوا clinical supervisor, education supervisor, tutor في المستشفى، وتاني deanery assessment people بيكونوا نفرين. فعادة بيكون في 5 people written in this supervisor area. هل الزول شغال فول تايم 100% ولا شغال 80% ولا 60% ولا whatever؟ إذا في واحد عاوز يعمل adding ليها، بيقوم الصفحة دي بتكون فاضية، بيقوم بيعمل add to supervisor، بتكون in the top left area، بيجيك 3 columns details, specialty and supervisor. فالديتيلز أول حاجة إنه الزول شغال full percent، الجريد بتاعه IMT 1 or 2 or 3 or which training that he's doing, and then the starting date, the end date, you need to put it in details, and then you are in program, and that's the second year. بعد حتمشي للسبيشاليتي شغال فيها، حتكتب مثلا كارديولوجي الآن، وبعدها حتمشي للسوبرفايزر، فكلها saved ورقم 3 saved، حتخط الاسم بتاع السوبرفايزر and you need to make sure which supervisor that he or she is supervising you in this post. عادة بيجيك ايميل just before the start of the training in that post. في ناس بيعرفوا supervisor after they joined the post. فبيوروك انه مين الكلينيكال supervisor، مين الeducation supervisor, and then you will add it on. You write the name, you will write which role exactly, والlocation اللي هو من الهوسبيتالز نيم، تعمل سيرش، بعد بيظهر لك الاسماء تحت supervisors، بعد بتعمل لها adding. في جزء من الهوسبيتال اوريدي بيعملوا لهم الحاجات دي added on قبل ما يصلوا للسنه المعينه. مثلا الزول ده يبدا IMT2 بيلقاها اوريدي added بالنسبه له خلال السنه كلها، لكن في جزء من الهوسبيتالز بتضطر تعمل لها add براك. لو مشينا actually عشان نشوف e-portfolio من هنا، نعمل stop sharing، نعمل share screen، portfolio NHS، دي نفس الحكايه، هنخش للاي بورتفوليو، الايميل، الباسورد او اليوزر نيم والباسورد، وبعد دي الصفحه زي ما قلنا. declaration السيرتيفيكيت declaration ما حاجه مهمه شديد في الاي بورتفوليو، بتلقاه اوريدي، يعني ما في زول بيسال منها in general. الاكزامز usually you can add your exam if you did any of those basic stuff, ALS, BLS or whatever, so you can add it on, especially the ALS for the internal medicine trainee, because it is quite mandatory if you are covering any crash bleed. Then the library, which is the most important area in the e-portfolio، بتتقسم لكمية من الحاجات. في ال ARCB، وال ARCB عبارة عن الاسسمنت اللي بيتعمل لك كل سنة، وحنمر عليها in details عشان نشوف انه الاسسمنت المطلوب شنو. اللايبرري عبارة عن التجميع بتاع اي حاجة انت او اغلب الحاجات اللي انت عملتها خلال السنة المعينة. فلو انت عملت اوديت وعندك ايفيدنس، ادوك شهادة او QIB، بتحطها هنا، بتقوم تعمل add هنا upload file, and then you will search where is the file, and then you will just add it on. Or you can just drag it to the library in here. Exams لو عندك أي course exam MRCP أو أي شيء you can add it on in here. لو عندك أي evidence بتاع leadership you can add it on here. Logbook also about the number of patients that you are seeing. Research, presentation, publication, you can just add it on in here. Teaching delivered, attended, or feedback that you get from people that you give a teaching to them, you can just add it on here. الحاجة المهمة في دي إنه مفروض تربطها بالكريكولم بتاع التريننج. الكريكولم هو الحاجات المطلوبة خلال السنة. وقبل ما نمشي للكريكولم محتاجين نفتح ال ARCB 8 decision. لو مشينا هنا قلنا مثلا ARCB 8 decision IMT for example, and لو شايفين معاي هنا أي سنة أنت مطلوب إنك تعمل حاجة معينة خلال السنة بتاعت التريننج. فمثلا دي IMT عندك IMT 1, 2 and 3. You need an education supervisor report by the end of each year to see that if you are meeting the expectation or exceeding it. The generic SIPs حنراجعها الآن والclinical SIPs. A multiple consultant report, that is a report that you need to collect from 4 consultants that they will tell about your performance, your general work, how you are reacting to the other colleague, if you are doing any data analysis أو أي حاجة. You need to collect 4 reports from 4 different consultants. كل ما تمشي في سنة تانية مثلا year 2 أو year 3, they need 3 consultants who are actually in the acute medicine or acute take working. For a total of 4 consultants, 3 of them need to be in the acute take أو acute consultants. multi-source feedback دي حاجات برضو مطلوبة تتعمل اللي هي بيسموها برضو في بتيكت تاني بيسموها 360 degree view اللي هي feedback from other people about you. At least بيكون 12 feedback بتكون mixed between physician and non-physician. We need at least 3 doctors or 3 consultants, I mean, from those 12 people. You can do more than 12, but at least it will be 12 people. 12 people كلهم انت ما بتقدر تشوف الاسسمنت بتاعهم، بتجمعوا كلهم. الاديوكيشن سوبرفايزر بيشوف الريبورت بتاع اي زول فيهم، بيديك السمري وانت بتشوف فقط السمري بتاع الكومنتس بتاع الناس كلها. You need to collect just one MSF, like a 12 rating every year in the IMT. في حاجة اسمها SLE أو Supervised Learning Events، ودي مقسمة لكم حاجة. واحدة منها ACAT، واحدة منها CBD، واحدة منها MiniCACS، واحدة منها OPCAT. نبدأ بالأسهل اللي هي CBD. CBD اللي هي اختصار ل Case Based Discussion، وهي معناها إنه لو أنت شفت كيس معينة you discuss it with your senior, either registrar or a consultant, and then you agreed a plan, and then he reviewed your note, and then he reviewed also what you did exactly about requesting investigation, putting a good impression, and putting a good plan for the patient. فدي بسموها ال case based discussion. هو بيعمل لك assessment بيشوف إنه أنت عملت impression كويس, you request the right investigation, you put the right plan. فدي بسموها case based discussion وبخد كومنت عليها. حاجة تانية حاجة اسمها mini CACS أو mini clinical evaluation exercise، ودي عبارة عن the direct supervision. يعني مثلا إذا كان في senior جنبك شايفك بتاخد history from the patient in front of him أو doing an examination in front of him أو seeing and assessing a patient from A to Z in front of him، فدي بتكون direct clinical evaluation. It is the same, almost the same like the clinical based discussion, like it is a direct supervision from your senior that he is seeing your assessment in front of him. الأوبكات اللي هي outpatient assessment او outpatient care assessment tool. واللي هي بتعني انه انت شفتها few patients in the outpatient clinic, you reviewed it with the consultant. He didn't need to see them basically, but you can just discuss it with the consultant, and then he will say that okay, your assessment is all right, you did the right thing, and yeah, that will be counted as one OPCAT. بيقول الأوبكات عادة بتكون فيها 3 patient at least ال1 OPCAT. القوانين بتختلف كل مرة، فالزول المفروض يكون updated. فالزول مطالب في IMT إنه يجيب 4 SLE من ديل، يا إما 4 CBD، يا إما 4 مينيككس، يا إما 4 أوبكات، and they prefer a mix of all of them usually. الحاجة الثانية اللي هي الACAT اللي هي الأكيوت كير أسسمنت تول، وهي البيشنتس اللي بتشوفهم في الأكيوت تيك أو لما تيجي تعمل admission لبيشنت from the ED department. at least you need to see 5 patients to be counted as one assessment or one ticket. It is the same like the CBD, the case-based discussion, between 5 patients or 5 CBD that will be counted as one ACAT. You will say that, okay, I saw 5 patients over the night, or 6 or 7 or whatever. And then you will say that, okay, the first patient, 78, came in with a known case of this and that. He came in with hemoptysis. I run through the history. It was involving this and that. Examination-wise, it was like this. I put an impression of this, requesting an investigation, and then that was my primary plan for the patient. فبعد طوال بتمشي للسكند patient. second patient is 50 years old وبتاخد باقي الديتيلز. فكونوا 5 patient in one ticket تترسل. عادة بيشوف الكونسلتنت اللي شاف البيشنتس next day أو the same day after you عشان يقدر يعمل لك assessment، تخطيط good plan, good investigation that's been requested for this patient, and you are safe and you are quite all right with your assessment. So you need 4 ACAT, يعني at least 20 patients هتكون in each year, which is not difficult. يعني. MRCB exam, in IMT1 you need to pass part 1 at least. In IMT2 you need to have the full diploma. In IMT 2 and 3 is the same. ALS, you need to have a valid ALS in all the years. And then the quality improvement project is the same. There's some details on it. And then the outpatient, we just discussed it. And yep, that is basically the decision. So that will help us with knowing how the assessment in here will be done if we go in here. Fine. Fine. This is some of the ticket that can be sent. وحنيجي للتيكت الآن عشان نشرحها. موضوع احتمال يكون شوية confusing. حتكون هنا التيكتس وحنشوف how to link it to your curriculum. Every year, beside those things that you need to do, you have a level of that you need to meet actually. So for example, if we went into this assessment, so if you can see there is level 1, 2, 3, and 4. 4 is a maximum level that you can reach, that you can act unsupervised without any supervision from any senior. And level 1 is like, it's just to observe only. And level 2 and 3, it is in between. So for IMT1, mainly it is to act with direct supervision. And with IMT2 and 3, then the level of supervision will be less because the responsibility will be high, and then it will be quite senior. And then according to this, the e-portfolio we'll go with it. So this is your curriculum in which we took it from here. So IMT1, then you have three main stuff: generic SIPs, clinical SIPs, and practical SIPs. Let's go back again in here. That's okay. You have a level also of the procedure that you need to do. So for example, for the CBR, if you are IMT1, a skill lab or as a satisfactory supervised practice is acceptable. By IMT2, you need to participate actively in the CBR team. And in the IMT3, you need to lead the CBR team. So you'll be acting as medical registrar in here. The temporal pacing, it is just a skill lab or a supervised practice in all the years. So it's not that big mandatory. For the ascetic tab, you need to be competent by IMT2 and to maintain the competence after that. It is the same for the lumbar puncture, NG tubing, and the ballure aspiration. And you have a level for all the other stuff like the intercostal drain, DC shock, and abdominal paracentesis. If we go back in here and we review the three stuff again: generic capability in practice, clinical capability in practice, and practical procedure skills. If we start with the easiest one, the last one, so you'll find the same stuff in here that you need to do. And then whenever you have any assessment done, you will just link it to your e-portfolio. And then you will say, okay, I have the evidence that I did a CBR or I lead a CBR in which one of the seniors, other senior, was watching you and telling that your assessment is fine. Or for example, you insert an NG tube and then one of your seniors signed a ticket for you and he said, yeah, you are all right, you are competent to do it and supervise or whatever procedure that you are doing. We will go through how to send the ticket exactly, but after we just finish this. So I think the practical procedure skills is clear mainly, but the other is a bit confusing. If you went to the clinical capability in practice, there is 80 stuff that you need to have an evidence that you did all of them. So managing an acute and selected take, that means that you are seeing a patient in your acute take, in which we just discussed, like the ACAT, acute patients, 5 patients, you discuss it with a consultant, you send the ticket, he signed it or she signed it to you, and then you will just link the signed ticket to this line. The same stuff will go through the rest. So managing acute is specialty related take. So for example, if you are seeing, you are covering general medicine and you are seeing a gastroenterology case, our GI bleed, or seeing cardio case, congestive heart failure, or whatever. So it is a specialty related thingy. So you are managing it. You send a CBD, case-based discussion, to your consultant. He was happy with the assessment. He signed it to you, and then you will link it to your curriculum. Providing continuity of care to medical inpatient, including management of comorbidity and cognitive impairment. And it is the same work in the ward round, that you are seeing the patient, you are continuing the plan, adding some stuff, requesting more investigation, having a safe plan, having a safe discharge. So you are continuing the medical care as inpatient. Managing patient in outpatient clinic, that just like we discussed, like the OPCAT, that you are seeing patient in the outpatient. Ambulatory is kind of the same. So there is one of the clinics called the ambulatory care unit, in which if you are seeing patient in there with the same with those cases, so you can send a ticket for that. Community setting, usually it is difficult to have an evidence for that, but it will be fine with ambulatory and outpatient clinic. The managing medical problem in patient in other specialty and special cases. So for example, if you are seeing an orthopedic case in your medical ward, or you are seeing a urology case in your medical ward, or any other special cases like a dermatology case or rheumatology case in your medical ward, so that will be counted as special cases and will be assessed by your consultant, who is already in your ward, seeing the patient with you, so he can evaluate your work in the ward and the assessment of that patient. Managing multidisciplinary team, including effective discharge planning, the same stuff. If you have a patient with multidisciplinary decision that's done, you can include a case like that in your assessment. And yep, probably your consultant will be knowing about that. Delivering effective resuscitation and managing acutely deteriorating patient. If you have any patient in your ward that got quite ill, deteriorated, and then you did this and that, so you can send an assessment about this patient to your consultant. And managing the end of life and applying palliative care skills if you have any patients like that in your ward. If you got confused and you didn't know which ticket exactly to send, there is an eye in here, if you can see. So that will help actually. So it will tell you what the managing acute take and selective take mean, and what exactly the thing that you can link to this area of the clinical SIPS. So that will all be an evidence for you that it can help you to provide an evidence that you are doing it. If we go to the last one, that is a generic, actually it is the first one, but yeah, we just kept it at the last one. So the generic capability, they need just to know that you are able to function successfully with the NHS, able to deal with the ethical and legal issues, communicate well with the staff and the patients, focus on the patient safety. So most of those will come from the multi-source feedback that you will collect from your colleague, but also you can find other evidence in the information icon, the eye icon, that you can see how you can link it to it. Number 5, carrying out research and managing data appropriately. If you have any audit or research that you are doing, you can link it in there after you put an evidence in the library, and then you will link it. Acting as clinical teacher, if you teach any student, you can just also collect a feedback, upload it to your library, and then you can link it in here. How to link? So you will just press in here, link, and then you will go to one of those options. For example, file in the personal library, if you put any file in the library, and then all the file will come in here. That's your library, and then you will press upload. We can use another one actually, so just give me 1 second if that's okay. I'm using more than one account to just try to help actually. So that's my actual account. So if we went to the curriculum and then we open the clinical SIPS, for example, so if you can see the linking area in here, so you can link, and then you will go to library, for example, and then you will choose where is your area that you want to link the stuff exactly. So MSF, for example, so you will say action, and then you will say, you will just tick it in here. So if you ticked it in here, it will be directly added in your linking. If you untick it, it will change from 7 to, I didn't check. Sorry, maybe this is not the great example. I'll just try another thing actually. So if we can go to the advanced rating, and then we go to the library, and then, for example, choose anything just to try. Yep. And then if you tick this, so that's 3 links at the moment. If you tick this, I'm not sure why it's not working actually. So add link. Yep. That's 4 now. Yep. So that is the way that you can link your stuff exactly. So we'll just unlink it again. That's been linked, so unlinked, delete. Yep, and that's been unlinked. If you want to add a link from another thing, like the ticket that we will just discuss now, so you will choose forms, and then you will go to the ticket that we'll discuss now to just add which ticket that you had exactly for your assessment. So for example, is it an assessment form that it's just generic one, or is it a DOPS, direct observation procedures, or is it MSF, multi-source feedback, or whatever that we are thinking about? We'll just go through it now. I think that is a bit okay for the generic SIPs, clinical SIPs, and practical skills. We will go now to the ticket request, how you will actually do it. So you'll open the assessment, you will go to the ticket request, press in here, it will come with this page, and then you will create a ticket. You'll make sure that this is the actual post that you are doing. So if you are in training and your post is changing, so it will change to the most recent one. So if you remember one of the ticket that you didn't send in the previous post, you need to change this and to send it to your consultant that he will be able to sign it for you. And then you will choose your ticket. So the ACAT we just discussed, that is a 5-page in the acute tech. The CBD, the DOPS is a direct observation procedure. So if you did any procedure of that we just discussed, like the lumbar puncture or the ascitic tabbing or any other procedure, you will choose a summative one. They are saying the formative one, if you did it and you couldn't be able to do it, like you failed it, or you are assisting in the procedure. So usually they will take the summative one, but I'm not 100% sure about the formative. Then the Mini-KEX, we just discussed it earlier on. So that is the actual assessment in front of the consultant. The multi-source feedback, that is a 360 view from the other team that they are seeing you, which include a mixed physician and non-physician team, at least 12 people, and including 3 consultants at least. And when we are mentioning a mix between physician and non-physician, that will include all the non-physician, like physiotherapist, occupational therapist, pharmacist, ward clerk, anyone who is not a medical doctor, so he can be evaluating you also. Multiple consultant report, OPCAT, the outpatient one. Patient survey, usually it is for the senior people, like the people who are ST4 and above. They will do that patient survey. And then quality improvement project and teaching observation. If you did any teaching to the department, and then you need one of the consultant or the senior that attended your teaching to give you a feedback for that. So that can be used as active clinical teaching in your curriculum. So how to do it? So for example, CBD, you'll press CBD, and then you will choose the email that you need. So you will press in here. So I will imagine that I will request it for my email, for example, just a fake email, okay? And then you will say, hi, Dr. Babiker, would you mind to sign this form for me, please? And you need to write the details. So we'll say, this is regarding the 76-year-old female who came in with blah blah blah, and then you will say all this stuff, and then you'll say thank you, and then you can complete some of your form if you want, so you can make it easier for the assessor, or you can just put this as off, and then you need to let your assessor to fill all the stuff, and then you will send the ticket in here. So create ticket. If you create it and then that's been sent, so it is outstanding, if you can see in here, that's been sent to this email, and this ticket will be in the system for 1 month. So your senior or whatever that the person that you sent the ticket to, he can see this ticket assessing you and then put all the review in the ticket that will come to him or her. You can send a reminder every time, but that every 24 hours. So you can't send it in less than 24 hours. So you can just press in here, send a reminder. So your assessor will get an email again that to remind him or her to sign the form. If this 1 month finished, so it will go to the declined or expired. Okay. Don't worry, you can still copy it. Just copy the ticket, and then you can send it to the same email. So you don't need to write all the stuff again. So if your assessor is like on holiday or he couldn't fill it in this 1 month, so you can just copy it again. And when this ticket is being completed, it will be in the completed assessment in here. So I'll just delete it just because we don't need it. And that is the way how to send the ticket. All right. Fine. It will be the same for all the stuff. So the ACAT, you will write all your 5 patients in the details. CBD 1 patient. The DOPS, you will write the details of the procedure. The mini-case, you write the case that you say. The MSF, you will just write a very short sentence that would you mind to sign this MSF for me, and then it will come with all the details in there. You don't need to write anything. The multiple consultant report, it is actually the same like the MSF. So we'll just write very short line and we'll say, hi, Dr. Babikar, would you mind to sign this report for me, please? The OPCAT is, you need to write the 3 patients as we mentioned. The patient survey is for the seniors, and quality improvement project, it is regarding if you did any quality improvement with one of your senior or consultants, so you need to write some details. Then the teaching observation, just you will say, would you mind to assess me regarding that teaching that we did about this topic? So that is regarding your ticket. If you go to the all forms, you'll find all the forms that you signed. It will be in here. So so you can easily link it with the same stuff. So you will find an icon, you will just link it to your curriculum, and that's it. Quality improvement project, it has another tab in here, if you can see. So you can create a form, you can send another forms in here in details. If you want to write all the details of the things that you did in your QIB. So that's also a good assessment that you can do. If you joined any post, in the beginning and the end, there is something called personal developmental plan. So if we go to here, so you will say that, for example, I joined endocrine, rheumatology, and all those things. So you can put a BDB or personal developmental plan, which you will be asked by the start of your post if you have any plan in this post that you need to do. You will just create a form, and then it is BDB in here, and then you will create it, and then there is some question that they will ask you, which placement that you are doing now, which assessment that you are wishing to do, and that will help your supervisor to just try to help you to access all the stuff that you need in this post or this time of the year. So that is a BDB. Reflections, we'll go to it. Summary of the IMT. If you did all the thing that you had, you will have the assessment for your consultant. So usually your consultant will go in details of all the curriculum, and they will sign every single things, and they will rate it in here. So they will say, okay, you signed 4 forms in the advanced CBR, so you seem you are competent in it, and you are reaching the levels, you are leader in the CBR. So I will rate him as For example, you'll say rate, that's your consultant, and then he will give the rating for your assessment. So it will say, okay, competence maintained, or he had the leadership, or competent to perform unsupervised. You need to review what the ARCB is saying about your year, and then that your supervisor need to choose those according to the evidence that you are providing. So after they rate all those stuff, it will appear in your summary of progress, in which they will have a look in it, and then they will say, okay, you have the report, they did it. Most of your things is done in your generic steps or clinical steps. You reach the such level that we need you to do or above. The MCR, you had those reports, and you will have all those things in place. So, and that is a good way to review your thing. So whenever you had one thing done, it will just appear in here. So in the beginning of the year, it will be a bit empty. And then whenever you had an assessment, it will be filled one by one. Whenever you did a CBD, it will come in here, 1, 2, 3, 4. Whenever there is any confirmation that you passed the part 1, it will come in here. You have a valid ALS, it will come also in here. So that is the way that you can go through your progress through the IMT or any other training. ARCB is the assessment that they are doing for the trainee team every end of the year. Usually it is in the beginning of June. They will put the assessment rating or outcome, and then they will tell you what the outcome is in, if they are happy with your assessment during all the year, or if they need some other evidence to be provided. So I think we went through all the important stuff in the e-portfolio. There is another link in the e-learning. If you have any e-learning that you did, you have an access to link it to the e-portfolio, and to provide more hours that you are doing. We need not to miss small things. We just mentioned earlier on in the personal library that there is a logbook that you need to show the number of the patients that you saw. So if we said acute calculator, and then we say ERCP-TB, you'll find in here there is an Excel sheet that you can click on it. And then if you can see in here, this is some of the procedure that you will say, but usually people will use the acute calculator in here. So you will say which hospital that you did, you are in now, which start date, which month, how many months in the post. So for example, if it is 4 months, average number of the acute take per month, that means how many on-calls that you are having in this month. So for example, 7, and then how many patients that you are seeing per each acute take. So for example, 7, and then it will just come with the total number of or the expected number of patients that you will be seeing in those 4 months, which is 196 patients. For example, in the IMT, you need to see 100 patients as a minimum number for seeing patient, and by the end of the IMT for the 3 years, you need to see 500 patients. So whenever you are rotating, you will just write your patients number, and then it will calculate by itself, and then it will go to the total number, and then need to reach the exact number that they need by the end of the year. Then you will save this Excel sheet. You will just upload it again in your e-portfolio in here. So we'll say upload file, and then you'll just upload the file from the area that you just saved the Excel sheet. So that is for the logbook. That just need to be mentioned. And I hope this session make things clear, or a bit clear for most of the new people who are new to the e-portfolio or they are struggling with it. You can add any folders in here. So if you want to create a specific folder for yourself, you can just add it on. Like in here, create new folder, and then you will name it. For example, if we can say, just say, for example, SEALS, and then you will say, you will find in here a new, this one, sorry. Create new folder. And then another folder in here just came in to your e-portfolio. So you can add any folder to organize your library as cool as you want it. So, and then you can also delete it if you want. So I hope that is clear. I hope it is fine. And I hope I didn't take too much time from you guys. So if you have any questions now in the next 5 to 10 minutes, I'm happy to reply for it in my e-portfolio. Thanks for Ammar, who gave me the access for the e-portfolio, his e-portfolio, to help in demonstrating all the things in his e-portfolio. Thanks for him, really. Yep, if anyone have any questions, I am here to listen, and thanks again for your attendance. Seems there is no question at the moment. We'll just wait to see if there's any question. You can just add it in the comment if you want. Yep, Mohammed and Noor Ishaq, thanks for the nice talk. Welcome anytime. Short summary for the reflective, please. Okay, yeah, I think I missed that actually. So thanks for reminding me. So reflection, you have some you need to show some reflection during your training. You have a lot of or types of reflection that you can do. You have a generic reflections, which you can mention anything in your in general as you would like to reflect something that you saw in your ward, or you was wishing to do, or you decide to do. So for example, or anything that you are thinking it was about to go wrong, and then you sort it out. Or even if you would like to reflect on learning event. So if we can say like generic reflection forms, let us add it, create forms. You will put the date of your reflection that you will say. You will put the title. For example, if you was about to or you knew a new protocol in the hospital that you was not aware of, for example. So we'll say learning a new guidance to treat this, for example. And then the location, your hospital, you will say what you were thinking about. So for example, you are thinking the treatment of such condition is this and this and this, and what you feel when you discover this guideline. So I felt that I need to to be more knowing about the guideline and to ask around my seniors if there is any specific guideline to treat such condition. And now what you will do, so I need to check with my seniors, and I need to be updated as much as I can in the next or in the near future for treating any patients with any new condition that I'm not 100% aware about. So that's a kind of reflection that you can do. If you mention that it is shared in a draft, so when you saved it, draft, no one can see it, and then not draft, then if it is saved, then it can be seen by anyone actually. This is one of the type of the generic reflection. You can have a reflection on a learning event that, for example, you saw a new condition that you didn't know about it at all before. Teaching you have delivered is one of the reflection that you are doing. Attendance of organized teaching, if you are in training, so you'll have the actual attendance in this teaching that you are having every 2 weeks or 1 week. So you can write it as reflection, but they will usually prefer the generic reflection form and the form of the clinical events as we just discussed. So that's kind of the things. فاطمة صالح سألت كيف ممكن ألقى الكريكولم. الكريكولم عادة بيجي طوالي مع الاي بورتفوليو. اي تريننج معين بيكون عنده كريكولم معين. فمثلا اذا زول في الهاير سبيشاليتي تريننج وعنده دول تريننج، مثلا شغال كارديولوجي او gastroenterology او anything of the dual training, they will have more curriculum than us. So they will have their specialty curriculum, and then they will have the general medicine curriculum. So it will be more stuff in here actually. So it depends according to which training that you are having. So if you join the training, you will have your own curriculum in your e-portfolio that will be sent to you. So they will give you a username and password. But if you joined as trust doctor, non-training, so it will depend according to which level that you are on. بتين نبدأ نشتغل على الاي portfolio as soon as possible. It depends according to when the assessment will be done to you actually. So most of the trainee will be stuck just before the end of the year. So the assessment usually will be done, for example, in June as the time of the year. So most of the people will be really stuck on May or just before that. And the consultant who are doing the assessment for those candidate, they will find it difficult to sign all those tickets for the people. So it's better to start it as early as possible for the e-portfolio, that for the assessment that you want to do. You can do 1 bit or 2 bit every 1 week, every 2 weeks. So every time that you are seeing a patient or you would like to do any specific assessment for procedure, then you can just add some stuff to your e-portfolio and just, yeah, don't be stuck at the end of the year. Yep. Any other question by any chance? Mm-hmm. Yep. ننتظر آخر دقيقة كده ونشوف. العفو. تسلموا الاثنين. Yep, welcome anytime, Mohammed Noor. yep, we really need to do that. So yep, to approach this essential work, we need to be better in giving time to it. Welcome, Khalid, anytime. Welcome, Muna. Thanks a lot. Yep, we'll be here for the next 30 seconds. If anyone have any questions, then we can wait for the question. Welcome, Isra, anytime. المحاضرة حتكون مسجلة إن شاء الله تبع سجدة. أيوة إن شاء الله. Welcome, نجاح, anytime. تمام. شكرا جزيلا يا شباب، شكرا على وقتكم، تسلموا كثير، ما قصرتوا. لو عندكم any question you can just add it to the comment just below it, and then I'm more than happy to reply it as soon as I can. So yep. Welcome, Dalia. يلا بالسلامة. شكرا، جزاكم الله خير، تسلموا كثير.